This is just the beginning.
Welcome to Vital's Checkup, a virtual event. I'm Caitlin Owens, a healthcare reporter at Axios. I'm joining you from my home in Washington, D.C. Thank you to United Health Group for making this conversation about social determinants of health possible. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, my colleague Sam Baker and I will be discussing how access to housing, healthy food, mental health services, and more affects the lives of patients. Our first guest is the representative from Illinois' 17th Congressional District, Representative Cheri Bustos. She's joining us from Washington, D.C. Welcome, Congresswoman.
Hi, Caitlin. Thanks for having me.
So let's just start off with this conversation. I want to hear a little bit about why you are interested in social determinants of health right now, and more broadly, why we all should be after the past year and a half.
Well, social determinants of health, I still remember the first time I heard that term. I'm like, that's awfully complicated sounding. But I think the best way to simplify it is this is like your everyday life experiences and how they impact your health outcome. And what we're saying by legislation that we've introduced and that we've been fighting for now for a number of years, and a brand new caucus that we've just started, what we're saying is that your health and your health outcomes should not be determined by what zip code you live in. And so this is looking at things like, do you have access to fresh food, to fresh fruits and vegetables? Do you have access to a physician if you need to get help? Do you have access to transportation to get to a doctor or to get to a pharmacy? And from a very personal perspective, not only did I work in healthcare for a decade of my life before coming to Congress, but we actually have a zip code in the congressional district that I serve where the only pharmacy that was located in that zip code, CVS, decided to close its doors. The only grocery store in that zip code, a Kroger, decided to close its doors. We have areas where it took 7 years to be able to hire a primary care physician. We have people who have to take 16 bus stops to get to a doctor's office. So these are real experiences that I'm telling you about. And so that's why we're focusing on those social determinants that impact somebody's health outcome.
So you've made a little bit of news recently with your work on the issue, specifically with your legislation, and then the social determinants caucus that you have helped create. What exactly is it you're hoping to be able that Congress will be able to do to address what kind of a very vast set of issues?
Well, the reason you start a caucus, if you're a member of Congress, is to actually advance a legislative agenda. And in this case, we started the social determinants caucus from day one with Republicans and Democrats. And so if you're going to get anything done in Washington, D.C., you better figure out how you're going to do that together. So we already have close to 30 members of Congress, Democrats and Republicans, who are part of this caucus. But the whole idea of that is that you get members of Congress together to talk about an issue that is important to the district that you represent. And that you help advance legislation that is important to the people who you serve. And in the case of legislation, we have what's called the Social Determinants Accelerator Act. And we've been very successful with that. We actually introduced it last congressional session to begin with. And the whole idea being that we would set aside millions of dollars. Our initial ask didn't end up being the total amount that we wanted, but now we've really advance the amount that we will put into this program. But we initially went for $25 million that could be grants for 25 different communities, grants of up to $1 million each, where we would empower local communities to investigate what are these social determinants that are getting in the way of people's health. And then once that was determined, then you would go back at a later time and figure out how you were going to fund actually addressing some of that. Well, now we have Joe Biden in the White House. We have a friend in the White House who understands social determinants, who is also putting aside money in his budget, $153 million. And so we now are advancing that legislatively in the House, with the idea being, let's investigate what these social determinants are. Let's let local communities apply for that money, and then have the money in that program to actually do something about it once those negative social determinants are discovered through investigation.
And how would you say the pandemic has influenced your congressional colleagues' interest in this subject?
We're living in a whole new health world because of this pandemic. What we've learned is that that telehealth can be an important part of somebody's health. That if all of a sudden you don't have access to mass transit because you can't leave your house, it is a problem to be able to get that health care. We actually live, the congressional district that I represent, which is basically all of the northwestern corner of the state of Illinois. It's 14 counties, 7,000 square miles altogether. And get this, 1 in 4 families in the 17th congressional district of Illinois, 1 in 4 don't even have the internet. Not even when we're talking about high-speed internet. And close to half of the people who live in our congressional district don't have high-speed internet access. So that is actually a social determinant. If you don't have access to be able to look up health information, to be able to access telehealth, which is becoming increasingly important, that is part of what we have discovered through this pandemic, that those are very important parts of a person's health. And we have many parts of this country that we need to address, even issues like broadband and how that impacts a person's health.
Well, so help us use our imagination here. How could, let's say your legislation becomes law and these grants are available for communities, how could a community use that money to help address the broadband internet issue?
Well, we actually have multiple tracks that are addressing this broadband issue. So that would just be one component of it. But Jim Clyburn, who's the 3rd highest ranking member of the U.S. House of Representatives, he's from the state of South Carolina. He actually leads what's called the Rural Broadband Task Force. I'm a member of that, as are many other Democrats in the U.S. House of Representatives, where our hope is that we address every corner of America and make sure that in time, that not only do we have the resources to map out who doesn't have access to high-speed internet, but then we have the resources to actually to be able to deliver high-speed internet to homes all over America. So that's just one component of it. But a rural community can get a grant, and they can develop a plan to fight their broadband issue with this money. That's just one example. As I said, we've got another community in the congressional district I serve that took them 7 years to hire a physician. So this is something where maybe there is tuition reimbursement for physicians to make sure that you can attract the best of the best to some of these more rural areas. The community that I talked with you about, that zip code is 61605, and if your viewers want to Google that, they'll find out that it is one of the most distressed zip codes in America. And it doesn't have to be that way. And the social determinants, with $153 million set aside to address communities like that in Peoria, Illinois, we can tackle some of these lack of healthcare providers, or lack of fresh fruits and vegetables, or transportation issues. Just the overall goal is funding to develop plans to fight social determinants that are impacting any community in America.
And what are you learning about what some of the most effective interventions are?
Well, when we launched this social determinants caucus last week, we had more than 700 interested parties that were on that launch. Think about that. That's pretty hard to do. 700 interested parties from throughout this country. On top of that, on the legislation that I've introduced, we have 100 supporting organizations to that. So my answer to your question is that our call to action to these 700 who were on this call was, tell us what we need to know. What are the biggest negative social determinants to a human being's health in your community? And so the idea is that we do this call to action, people get back in touch with us, and we use that to write future legislation. But the whole idea, Caitlin, of the $153 million is that we say, communities, tell us what your problems are, apply for this money, use this money to investigate the root cause of this, and then use this money to help fight those negative social determinants. That's the whole idea of this. It's not just doing the so-called, let's study this. I mean, you know how that works in Congress. There's a lot of, let's just study this. This $153 million goes beyond that. It's let's study it and then let's tackle it. And so I think that the answer to your question is it can be all sorts of things. Some of the examples that I gave you, the 16 bus stops, the no pharmacy, the food deserts, et cetera. But your viewers can go to congressional SDOC, Social Determinants of Health.org, and look up and give us your ideas. And please do that. I hope maybe you can post that when you air this. But we would love to hear from people. This is an information gathering time, but please, viewers, share that with us. It's the Social Determinants of Health caucus.org.
Congresswoman, we are running out of time, but we like to end with one fun thing. I believe you are retiring after this term in Congress. What are you most excited about in this next phase of life for you?
Oh, wow. Well, so I like to look at it as I'm not retiring. I'm just not running for reelection. I am, by congressional terms, I'm young enough where I have at least another career or two in me. And my goal will be to make a difference. I've been very, very fortunate in my life. For 17 years, I was a reporter. I was a journalist, where every day, as you know, Caitlin, you can walk into your newsroom and you've got the ability every day to make a difference. Then following that, I worked for 10 years in healthcare, felt the same way. I could make a difference every day. And then same thing now. It'll be 10 years when I'm done with this term. And every day I've been in a position to help make a difference. And I just want to continue that track record. We'll see what direction that takes. And I will keep you posted. But I'm just hoping that it is something meaningful, not only to me on a personal level, but meaningful to the communities that I've been able to serve, my state, my nation. And we'll just kind of see where that goes.
Thank you so much for joining us.
Thank you.
Next, we have a view from the top segment with my colleague, Chief People Officer at Axios, Dominique Taylor.
Thank you, Caitlin. Now joining us from Orlando, Florida, Executive Vice President and Chief Medical Officer at United Healthcare Employer and Individual, Dr. Rhonda Randall. Welcome.
Thank you, Dominique.
Dr. Randall, can you tell our viewers a little bit about United Health Group, as well as the work that you're doing to address the social determinants of health to improve outcomes?
Well, I'm happy to share with you more information about what our 330,000 team members of United Health Group, both in the US and around the globe, do to dedicate themselves every day to help people live healthier lives and help the health system work for everyone. United Healthcare delivers health benefits and services, and Optum enables and delivers that care through clinics, through direct care providers, health systems, employers, and supporting governments and life sciences company. And throughout our company, we're all working to modernize the healthcare system and expand care, improve quality and affordability, and importantly, enhance that experience to achieve better health outcomes. A lot of the information of what we've been doing lately and what we believe can be found in our sustainability report recently released, you can be found at sustainability.uhg.com. And stemming from our longstanding beliefs that all individuals should have access to high quality, affordable healthcare that meets their unique needs, we're deeply committed to addressing healthcare disparities, social determinants, and advancing health equity. And we're looking at data and making specific targeted investments in social determinants of health. We've recently introduced use of a predictive analytic tool to improve well-being, to lower costs, and drive engagement. It's a program that builds on our existing initiatives and work with the American Medical Association so that we can document and have doctors appropriately code those social needs so that that information can be used to close gaps in care. For more than 2 decades, we've been leading efforts to identify and monitor health disparities in collaboration with community organizations as well as national partners, all in the name of advancing health equity. And while we've made measurable progress, we know that there's still a lot more work needed to do.
And traditionally, efforts to improve outcomes in the US have been wholly focused on just the healthcare system. But there is this increasing recognition that addressing the social determinants of health is what's key to improving outcomes and advancing health equity. And you've touched on that. But can you go a little bit deeper on how social determinants of health impact outcomes and what you're doing to help address those challenges?
Sure. Well, certainly I'm a physician, so we all know that care related to our health, particularly high quality care, is really important on public health. And research has shown that in addition to that, there are many factors contributing to and driving our health outcomes. And ultimately, it's where we're spending our time that's not in the doctor's office. It's in our communities, in our homes, and in our places of work. So things like housing, education, food insecurity, and transportation and access to care are important. And those social determinants of health and advancing health equity is really integral to building that future sustainable, modern, high-performing health system. And to do that, we have been publishing at the United Health Foundation now for more than 3 decades, a report called America's Health Rankings. And this summer, we released our inaugural Health Disparities Report, which looks at 30 different measures of health, the depth, the breadth, and the persistency of those disparities. It looks at them by race and ethnicity, by gender, by geography, and importantly, also by educational attainment. And some of the areas where we found housing really important, a significant difference in households headed by Hispanic, Black, and American, Indian, and Alaska Native households. They're more than 2 times more likely to have severe housing problems than households headed by whites. And so when we look at some of the initiatives that United Healthcare has brought to bear in that around homelessness, we have helped thousands of seniors, veterans, and individuals with disabilities find stable housing. And in fact, over the last several years, we have committed more than $500 million in investments in affordable housing. Food insecurity, another really important one. Our data in the disparities report revealed why disparities particularly notable in American, Indian, and Alaska Natives. The subpopulation increased by 39% between 2003 and 2019. So things that we have done, making sure that food insecurity is not happening due to a lack of resources. We know that there's strong ties with chronic diseases like obesity, diabetes, and high blood pressure, as well as mental health conditions. So to address that, we provided nearly 70 million meals last year to food banks to help distribute them to underserved communities. Mental and behavioral health, really important. We have within our Optum team a partnership and a delivery system called Genoa, and they provide telebehavioral health, but also the delivery of pharmacy right next door to community mental health clinics, providing patients in the same facility where they receive their behavioral health care with their medication, which creates a seamless experience, particularly for vulnerable and disadvantaged populations. From an educational attainment standpoint, the report has illustrated something that we've seen for quite some time. There's a strong correlation between the level of education you have and your health over the course of your lifetime. In fact, adults who have less than a high school education have almost 3 times a lower rate of reporting high health status than those who have graduated for college. So we have some partnerships here as well. One of the ones that I want to mention is our Diverse Scholars Initiative. Since 2007, the United Health Foundation has provided more than $23 million to fund more than 3,000 scholarships for diverse scholars in healthcare fields, in particular primary care.
It's really extraordinary, both the research that you've done into these issues as well as the work that you're doing to address them. My last question for you is just what's your top priority as you look ahead for the coming months and year?
One of the top priorities for our nation needs to be addressing the disparities in maternal mortality, particularly among Black mothers. They face a maternal mortality rate 3.5 times higher than Hispanic mothers. And some of the things that United Healthcare has done in that regard is supporting a program in Women's Hospital in Louisiana called GRACE. Through support of that program, we've seen a 21% decline in neonatal intensive care unit use and a 12% improvement in average birth weight of babies. So some nice progress there, but much more needs to be done on a national level and within communities.
That's truly impressive, both the research that you're doing to uncover the drivers behind these issues, but then the work that you're doing to address them as well. Thank you so much for coming here today to share your perspective and your experiences and for the work that you are doing.
Thank you for your time.
And thank you to United Health Group for sponsoring today's conversation. And now back to my colleague, Sam Baker.
Thanks, Dominique. I'm Sam Baker. I'm senior editor at Axios. And our final guest today is the director of the FXB Center for Health and Human Rights at Harvard University and FXB professor of the practice of health and human rights at Harvard's T.H. Chan School of Public Health, Dr. Mary Bassett, joining us from Boston. Dr. Bassett, hello.
Hello. Thanks for having me.
Thanks for taking the time. So let's sort of start big picture here. Obviously, the pandemic awakened a lot of people to some of the very long-standing, entrenched systemic inequalities within the healthcare system. People have been having that conversation and remarking upon the raised awareness of these facts for over a year now. These are bigger problems than obviously anyone's going to be able to solve in a year. But are we making any progress?
Are we making progress? Well, it's true that the COVID pandemic really sort of pulled back the curtain on the longstanding racial and ethnic inequalities in health. And having the curtain pulled back is always a good thing. The fact is that all of us have been getting healthier over the past decades. The 20th century saw the biggest advancements in life expectancy that have been documented in human history, but they weren't experienced equally. And that's a problem. And it wasn't just a problem of access to healthcare, although we all have the right to access to healthcare, in my view. It's also just about access to all the things that make up a healthy life. And those in this country are deeply divided by racial, ethnic classification. So are we making progress? This is the fact in public health. It's often sort of 2 steps forward, 1 step back. Progress, but still far to go. And COVID has set us back further, as you've seen with the recent life expectancy data, for example.
Who is sort of in the best position to drive this forward? I mean, it's such a complex problem with so many, just even within the healthcare system, it's all, very entangled. Then once you really start talking about social determinants, you're talking about real broad societal problems. Some states have tried some interesting things with their Medicaid programs. Some health systems, at least before the pandemic, were experimenting with things like providing housing. The Biden administration has made racial equity, at least in the org chart, has made it a priority. But where do you think that big push needs to come from?
Well, it really has to start at the top. And we've had, for the first time, a president utter the words white supremacy. And he talked about it in his inaugural address. He talks about racial equity. And it has to be set from the top. When I was health commissioner in New York City, I made it clear to all of the heads of divisions in the health department, and it's a pretty big health department, that this was an issue for each and every one of them. It wasn't just a problem of the program divisions. It wasn't just a problem of people who dealt with heart disease and cancer or people who dealt with communicable disease. It was a problem that we had to confront in the HR department and how we allocated the budget and where we invested most intensively. It really was a question for the whole of the agency, and for our country, it's a question of the whole of society. But it is important that public health people talk about lives being at stake, and this not simply being a moral issue, but an issue about our ability to live long and healthy lives. This is not a healthy situation for white people either. And we need to make it clear that this is a whole of society issue that we all need to face, and public health people should lend their voice to it, even if it means getting out of our lane.
I want to ask you specifically about some of the differences we've seen in COVID vaccination rates. We had an interesting slice some data that we've done with Ipsos, our polling partner, looking just at people who aren't vaccinated, who's sort of persuadable and who's really dug in. And we found a whole lot more people of color, Black and Hispanic Americans, in the persuadable category than in the dug in category. So I guess in the universe of people not being vaccinated, that's probably good. Do you have a sense of what it would take to persuade those persuadable communities?
Well, I think that a lot of people were in the wait and see category, and that's what you're referring to here for people of color. And that means, talking to the people who are the trusted messengers. And unfortunately, that hasn't always been government. So this really relies on government forming ties with people who are trusted, faith-based leaders, people who, are in the barbershops, and people who run longstanding community-based organizations like WISE and settlement houses. And it means government forming partnerships with people who are trusted in the communities where, frankly, there has been a basis for mistrust. Government hasn't always been trustworthy. And that seems to be resulting in progress. And Black professionals have really stood up and lent their voice. Something like 60 members of the national academies who are of African descent called on the community to step forward and get vaccinated. All of that helps. And all of it has to be in the setting where the vaccines are available, accessible, and people can get them without cost, and they have to be able to understand that. So the accessibility issues have to be off the table, and then we need to tackle why it is that people aren't trusting, and often that means acknowledging that they have reasons not to be trusting.
And so, given that caveat, as you said, people sometimes have a reason not to be trusting. Do you think mandates help or hurt in this?
Well, that's a really good question. We've, had mandates for children going to school for a long time, and that children need to show that they've been vaccinated. And I think that in some ways really simplifies things for people. It's a difference to talk about mandates by government institutions and mandates by private institutions, which might be hospitals, universities. And many are stepping forward and deciding to go forward with mandates. And I think that makes sense. It is truly a case of the challenge of public health, which is the need to protect the many and the whole idea of protecting individual rights have to be balanced. And on that scale, public health always puts the protection of the majority of people as carrying more weight. And I'm a public health worker. I believe in that.
Well, so given that background and specifically, your experience in New York City, none of this is easy, and I certainly don't envy the job that the CDC or the FDA or Dr. Fauci or anyone has in communicating this evolving risk situation. But, there does seem to be some confusion around, maybe finally some good faith confusion around why do vaccinated people still need to wear masks? Is it over? Does that mean they don't work? Do you think how would you rate the messaging and communications here?
Well, it has been confusing. I think that we need to acknowledge that. And for me, being vaccinated, and I am vaccinated, really carried as its principal benefit that I didn't need to worry about dying of COVID, and I didn't need to worry as much about transmitting it to other people. So those were my benefits. The mask didn't really matter that much to me. And clearly, we're going to remain in an evolving situation until we get our vaccine coverage rates up pretty high. And then we have the problem of the rest of the world. So I think that that prudence is the better call here, and I'm glad that they've made this recommendation about indoor masking. Makes sense to me.
Okay.
But it has been confusing. And part of it, I think, was driven by this idea of like, if I can't change anything, I still have to wear this mask. Why get vaccinated? Well, that wasn't the reason to really emphasize the importance of vaccination. The importance of vaccination is that you reduce personal risk and reduce risk to others.
Well said. Okay. Well, I think that is all the time we have. Thank you so much. I know you're very busy and you've been generous with your time with us today. It's always great to hear from you. Thanks so much for joining.
Thanks a lot.
And thank all of you for joining our Vitals Checkup series this afternoon, which has made everyone smarter faster. Thanks also to our sponsor, United Health Group, for making this event possible. For more information and to sign up for our daily healthcare newsletter, Axios Vitals, visit axios.com/newsletters or download the Axios app. Thanks again for joining us. We will see you on axios.com and when Vitals Checkup returns in the fall.